Yeah, HER2 is one of the important target for gastric cancer, which is detected in around 10% of patients by gene amplification. And HER2 positivity is usually defined by immunohistochemistry or as well as the gene amplification. And here we have around 15% of patients with HER2 positives. First important step is the TOGA study, which established the chemotherapy plus Trastuzumab as a monoclonal antibody for HER2 to show the improvement of survival. And now this is a standard first line in front line. But unfortunately, subsequent several other randomized studies failed to show any survival benefit over other HER2-targeted therapy like Lapatinib, Pertuzumab, T-DM1, or Trastuzumab beyond progression. And these results are quite different from many success in breast cancer. So there are several possible reasons of this negative result. One of the most important reasons should be intratumoral heterogeneity of HER2 expression in gastric cancer. And this is quite common in gastric compared with breast. Also, around half of patients showed reduced HER2 expression, and the activation of other pathway or downstream pathway are also important. So to overcome these issues, there are several treatments to develop. First one is a combination with a PD-1 blockade. Previously, two small phase 2 study showed a very impressive response rate or progression-free survival with chemo plus Trastuzumab and pembrolizumab. So based on this result, Keynote 811, the global study was conducted to compare chemo, Tras, and pembrolizumab versus current standard of care. And the interim analysis showed a remarkable improvement of response rate. And this clearly suggested a synergistic activity between anti-HER2 and anti-PD-1, and now already becomes one of the standard in United States because of the accelerated approval based on this response rate, but not yet in other countries. So we are waiting for PFS and overall survival. And the other important modality is antibody-drug conjugate or ADC. One of the important drugs is Trastuzumab Deruxtecan or T-DXd, which has a higher drug to antibody ratio compared with previous antibody-drug conjugate like T-DM1. And this T-DXd showed a very good response rate in phase 1 trial. So then randomized phase 2 trial was conducted in Japan and Korea, showing clear improvement of response rate and survival, and now approved in Japan and the United States. So in US, it can be used as a second line, and in Japan, it is a third line or later treatment. So other treatments are still in clinical trial phase under investigation, and these include bispecific antibody, a newer immunotherapy like a cellular therapy or vaccination. So these should be hopefully improve the outcome of our patient in near future.